Genetically droopy brows. Is this result possible using Botox? About a month ago, I got Botox to try and lift the tails of my brows, but I am not satisfied with the result. I got 4 units in each brow, and while there has been a very small, kind of unnoticeable lift, my goal is to have brows start and stop at the same level, height. I think I will go to a plastic surgeon or dermatologist rather than the med spa next time, but I'm curious to see if these results would be possible through Botox alone. I'm 22, so I'd like to look into non-surgical procedures first.
Thank you for your question. You're 22 years old and you went to a med spa with the intention of trying to lift the droopy tails of your eyebrows. And you got 4 units of Botox per brow, and you state that there was a slight elevation, and you state in your question, which you submitted photos with, that you want to make the tail of the brow more level with the inner part of your brows, and that you want to start with a non-invasive approach first, and you're considering going to another level of medical professional to achieve this result, but I think you're basically looking for some clarification on whether it's feasible. Well, I can certainly give you some guidance. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been using Botox for patients since 1993, and our specialty, oculofacial or oculoplastic surgery, were amongst the first doctors to use Botox to help patients with various medical issues before it became popular for cosmetic. So I'll give you some guidance as to how I approach situations like yours in my practice. As I said, I've been in practice for over 20 years in Manhattan and Long Island, and I think that one of the things that I would want to help you understand is that at 22, your eyebrows really technically are not drooping. What you're dealing with is essentially an anatomic structural issue. In other words, the bone structure, the muscular skin and fat structure around the eyes, the eyebrows have a shape that is probably consistent with your genetics. So now the limitations of interventions have to be at least understood before you move further. And again, this is my opinion based on photos, not a physical examination. So there's a limitation here. But I think that even if you go to more established doctors compared to med spa, and I don't know what kind of doctor was at the med spa, you may find yourself hitting a hard wall in terms of the level in which the eyebrow can actually elevate. When I look at your photos, my perception is not that your eyebrows are droopy, and that I think that you have to also understand that not only is the actual architecture and structure limiting how much the brow can come up, but also the amount of skin and between the brow and the eyelid will be limited, because if you really want to get the tail of the brow up to a level that's that horizontal, I'm pretty confident that it can't happen with an injectable, and even with the surgical procedure, it still would be difficult because you are young and there's not that much skin. When people are older, there's volume loss and there is elastic changes to the skin and soft tissue. When you think about the soft tissue and how it responds and relates to the bone structure, the muscle, the fat, and the raw genetics of this area, you also have to think about the limitations of the skin. When you think about how much your brow can be lifted, think of the tension that it would actually be pulling on your eyelid if the brow were actually able to be pulled that high. Which brings us to the topic of surgical procedures. As people get older, there's volume loss, there's diminishing of soft tissue, and the tail of the brow tends to droop. And we have a lot of different ways to help do that for people with aging changes because the brow has drooped. From adding filler into the temporal fossa in that space, to temporal brow lifts, to all kinds of other procedures that all fall in the category of lifting something that is drooping. Now, certainly people with a certain anatomic congenital issue can have comparable procedures, but I think in your situation, any surgical procedure would not likely to be successful. I think that you have to think about the aesthetics and the realistic possibilities with what you're pursuing. Again, at 22, again, and this is again my opinion as a facial aging specialist, I feel like at 22 you're limited by the actual benefits of being young and having everything in the right place. I think that you may want to just get additional opinions and ask about realistic outcomes. I think that the one criticism one could potentially have is that you may have just done something to see what would be the outcome, and I'm sure the med spa probably explained to you what the limits can be. And since Botox is one of those treatments where it's not permanent, you can try it, see how you like it, and if you don't like it, you're done with it. I think that's probably what was their objective, was to at least have you see what the potential is. You saw some improvement. Chances are you're not going to see that much more of improvement from anybody else. But I think that as a scientist, the best way to I answer questions is by testing. So I think you probably want to consider testing this as well. So I hope that was helpful. I wish you the best of luck. Thank you for your question.